Let's talk about the various supplements and how they affect your thyroid functioning. The most important one in my mind is probably selenium. So if you have hypothyroid, if you've been diagnosed with it or have a strong family history or even just have the symptoms of an underactive thyroid, check your selenium levels and take a selenium supplement. I really like selenium methionate, and I think that's the one that should be taken. The other supplements that you can take and you should look into are magnesium, vitamin D, omega-3, CoQ, especially if you're really fatigued and low on energy. Look at gut health. So if you have a leaky gut or have any gastric symptoms, then include more fiber in your diet because that will also really help. And vitamin B12, of course, vitamin D, if I've not said that already, because that helps with every single organ of your body. NAC is really good, which is N-acetylcysteine, which is actually a precursor to glutathione. I'm not a big fan of glutathione per se because it's very unstable, so taking a precursor will actually help glutathione endogenous production in the body. If you take all these supplements, you can hugely help the way your thyroid functions, and you may need even a lesser dose of your thyroid hormone. And even if you don't have thyroid issues, and like I said, if you've got symptoms of an underactive thyroid, if you're tired, weak, fatigued, if you have intolerance to cold, if you're unable to drop weight, adding these supplements depending on your symptoms can hugely help. These are the tests that I recommend you do to rule out hypothyroidism, or if you already have hypothyroidism and it's controlled with an optimal TSH but you still have the symptoms, this is what you need to do. Run these tests. Do not just a T3, T4, TSH. Most patients who come to me have done a T3, T4. You need to check for a free T3, free T4 and not the total. The total is bound to a protein and you need to check the free levels to know the real optimal functioning of your thyroid gland. So free T3, free T4, TSH, test number 1. You need to then check for your antibodies. So you check for your anti-TPO antibodies and your TG antibodies if you specifically want to rule out Hashimoto's, because that can clinch your diagnosis. And if you are somebody who's chronically stressed, this is not a test I ask all my patients to do, but if you have chronic stress levels, if you're not able to drop weight and the rest of the tests are normal, then run a reverse T3 because maybe you're just making too much reverse T3 because of your chronic stress. And then there are other ways that we can manage the free T3. Also, do your liver enzymes because most of the free T4 to T3 conversion happens in the liver and you need that to function optimally for your thyroid to be able to function well. So make sure your entire thyroid panel is done. There's no reason why you can't control your thyroid or your thyroid symptoms.
Should you take your thyroid medication on the morning before your blood test?
No, you shouldn't. Take it after your blood test, else it will interfere with your thyroid report.
If I have hypothyroidism, will it be difficult for me to get pregnant?
So, the optimum level of your TSH should be under 2, not from 0.5 to 5 like the range says. So if you're at 3 and 4, then yes, it can hinder it. But if you're under 2, you should have a smooth pregnancy.
Is there anything that can hinder the absorption of my medicines?
Yes, most people drink coffee right after they take their thyroid medication, which will interfere with the absorption of your medication. So keep a gap of at least 2 or 3 hours between your meds and your coffee intake.
Are there any supplements that interfere with my thyroid health?
Biotin, the most common one that I see at the clinic. Most people are taking biotin for hair health. It almost certainly will show erroneous thyroid report. So knock it off. Well, the publication says 2 or 3 days, but I tell my patients to knock it off at least 5 to 7 days before testing for your TSH levels, and you should be good. Also, not a supplement, but antacids is something that everyone takes regularly. Don't take that. That will also interfere with your thyroid absorption.
If I forget to take my medicines in the morning, should I take it in the evening?
I would say skip it completely that day and take it the next morning. So give it 24 hours.